Indians are chapati and rice lover, but when the blood sugar level increases, they're asked to stop them. But do we really have to choose between rice and chapati? I am Dietitian Lakshita Jain, and in this episode 3, let's talk about our rice and wheat chapati, diabetic friendly, and how we can make wheat flour chapati, white rice more diabetic friendly, and lastly, brands claiming to be helpful for your increased sugar level. Now, before we start, click on the subscribe button for my daily 30 days diabetes diet video. Okay. There was a study done on 10 healthy individuals who were given two types of meal. The test meal 1 consisted of moong dal, bhindi sabzi and 2 wheat chapati. In test meal 2, wheat chapati was replaced by cooked white rice. Bhindi sabzi and moong dal remained the same for both the tests, and they were given 50 gram available carbs in both the meals. On day 1, they were asked to eat 2 wheat chapati, bhindi and moong dal. 2 days gap were given in between, and on day 4, wheat rice, bhindi, moong dal was given. In the study, it was found that the glycemic index, or the raise in the blood sugar level after consuming of food, in this case was mixed meal with chapati made from wheat and that with rice, were not significantly different. But what about you? Can you eat 3 wheat chapati or rice every day and not spike up your blood sugar level? Now for this question, let's be smart and use this study to check our blood sugar spike. What we have to do on day 1, have 2 chapati, bhindi sabzi, moong dal in lunch. Write down the meal time and check your blood sugar level before lunch and 2 hours after the lunch. Then on day 4, repeat the testing now with the white rice, bhindi and moong dal. If your blood sugar level after eating wheat chapati and white rice is under 150 mg per dl, then you can continue eating it. If not, then reduce the quantity of how much you're eating rice and chapati. Now let's make them diabetic friendly at home itself. Now for making 2 chapati, here I am using 10 grams of wheat flour and 10 grams of amaranth flour, which is also called as Rajgira flour. You can also take 20 gram wheat flour if you want. And in this, I will be grating bottle gourd or lauki and 2 spoons of powdered flaxseed. This will not only reduce your blood sugar spike, but also increase the fiber in your diet, which is a win-win situation. Now for white rice, take 20 grams of cooked white rice and now saute it with your favorite 5 vegetables. I'm using peas, onion, tomato, zucchini and spinach. And finally, let's talk about brands marketed as diabetic friendly flour and rice. Now for chapati, I have picked 2 diabetic friendly marketing brands, Diabetic Sugar Control Atta and Ashirvad Sugar Release Control Atta. Now, whenever you're reading a label, always see the ingredient list first. And the first 3 ingredients is what the flour is made up of. Let's start with the Diabetic Sugar Control Atta. The first 3 ingredients are seeds, soy flour and isolated soy. Overall, the ingredient looks very diabetic friendly, but not for the patient who have thyroid as well as diabetes. Let's check the Ashirvad Sugar Release Control Atta. The first 3 ingredients are wheat flour, multigrain mixture and psyllium husk, which is also called as isabul. Overall, this also looks very diabetic friendly, but my pick will be Ashirvad Sugar Release Control Atta instead of Diabetic. Now let's check Diabetic Smart Diabetic Control Rice. If you see the ingredient list, it is Sona Masuri rice, which itself is a diabetic friendly and is a hand pounded rice. And now for the second brand, I am choosing Sugar Watchers Low GI Rice for ingredients. It is marketed with a lot of health gurus and it is claimed to have GI less than 55. They have also shown a test too, but the method how they achieve this is unclear. So I would choose Diabetic Smart Control Rice instead, which is a Sona Masuri rice. Now for the episode 4, let's discuss how you can use the blood sugar chart and learn by yourself which food suits the best to control your blood sugar levels, as we just did on day 1, day 4 using wheat and rice. I am Dietitian Lakshita Jain and this is my 30-day series on diabetes diet where I teach you how you can manage your blood sugar level by yourself for pre-diabetes, type 1, type 2 and gestational diabetes.